Hello everyone, welcome to National Time Health and Fitness special program. Today we have with us Dr. Senthil, who is a physiotherapist. Welcome Dr. Senthil at National Time.
Thank you so much. Hi, doctor.
So, Dr. Senthil, tell me about something about you. What's your business, what you are doing in physio, and when you started this?
First of all, Rajivji, thank you so much for inviting me
Thank you.
for this program. I really feel very pleased to be here in this program. My name is Senthil. I'm a physiotherapist for almost 25 years,
Okay.
educated from Chennai, India. I moved here 11 years ago and I started my own physiotherapy unit here. Our clinic named Fitness Canada Physio and Massage Center.
Okay.
Right now, within this 10 years, we have 5 locations across the city of Calgary,
Okay.
offering several services along with physiotherapy, like massage therapy, acupuncture, Ayurvedic massages, psychological counseling, like that. We offer all therapy needs under one roof. Even in physiotherapy,
Yeah.
we have specialized physiotherapy services like concussion management, vestibular management, motor vehicle accident management. We give all the therapies under one roof, so that once a patient comes to us for any therapy needs, they need not look up elsewhere
Wow.
for any therapy.
It's a one-stop shop, we can say, for physiotherapy.
Exactly.
Okay. So these days it's a winter season basically, and what we see in these days, the most of the people, due to snow condition, most of the accidents are happening, and some people are getting slipped on the roads, offside, on the road, or when they're coming out from the home. Sometimes they don't know that the black ice is out there. So what is your suggestion for if someone met with an accident, what first thing they have to do?
Yeah, that's a very good question and very important hot topic
Yeah.
for this weather, especially today. It was so, while I was driving here, it was so slippery and people were so scared driving.
Yes.
So it delayed my reaching here. So it's very important to know what to do, especially when we ourselves are involved in a motor vehicle accident. You know, like unlike back home, accident is not a very rare thing. Here it is very common.
Yeah.
That is one thing we have to understand. Once you are in the road, on the road, accident is a common thing. So first thing, if you are involved in an accident, you have to understand this is common here and don't panic. If you panic, things are going to get worse.
Yeah, whatever happened, happened.
It happened. So
Yeah.
what next? That should be our question. And this is not uncommon. That's what I'm coming to say. It's very common. Like, you know, that's why we pay insurances. That's why we cover ourselves, so that in case if there is a physical injury, we can get treated, or in case if there is a damage for our car, it can get fixed.
Both things can fixed.
Both things can. That's why we all are paying
Yeah.
the insurance.
Yes.
So there is nothing to panic. First thing is, on the road, if there is an accident, most commonly it happens because of poor visibility and the poor road conditions. Even the road is good, it's still slippery, icy. So you have to first see whether are you safe to stay in the car. So of course, if it is in the highway, then you don't have any other choice. You have to remain in the car
True.
until you get some help. Or if you are within the city and if you find a building next door where you can go safely, it's always better to do that.
Okay.
Of course, you still have to take pictures of the scene, and if you are hit by someone or if you hit someone, you still have to exchange your insurance and contact details for both of you. So
Most of the time, what happened after the accident, when we met with an accident, after we have some stress and whiplash, which is the main thing, which is happening after 1 or 2 days. So how to get out of that thing?
when we are rear-ended, our body is still in the momentum as you are driving, right? Like, but the seat
seat
belt
belt, yeah.
holds you back. So the body goes forward and comes back. The head goes forward and comes back. That causes severe strain in the neck muscles,
Yeah.
which can cause severe headache, which can also cause severe neck pain, back pain, all symptoms, the whole body pain, you know.
So, Dr. Senthil, what is the basic 4 categories which we are discussing about that?
Yeah, after a motor vehicle accident, based on the involvement of different parts of the body and based on the brunt of the injury, we classify into 4 categories. That's what I said. The first category we call whiplash associated disorders grade 1.
Okay.
That is WAD, WAD, WAD 1. That is simple pain. People come with simple aches and pains in the
Neck
neck or in
pain,
the back.
shoulder or the back.
Yeah, just one joint involvement, nothing big. They will get better maybe in couple weeks rest and some pills and some therapy. They'll be all right. But grade 2, when neck pain associated with radiating arm pain or back
Yes.
pain associated with
With the
radiating
legs,
leg
yeah.
pain, hip
Yes.
pain, shoulder pain, like involvement of more than one joint and involvement of joints, ligaments and muscles, then it is classified as WAD 2.
Okay.
Which is very common. Almost, I should say, 80 to 85% of the injuries happening on motor vehicle accidents fall under this category. These are the people who require more therapeutic interventions like
Okay.
physiotherapy, massage therapy, chiropractitioner, acupuncture, all those therapies. We need to treat them as a team to get them better. That is grade 2. Grade 3 happens when there is involvement of there is any nerve injuries or anything, then it automatically goes under grade 3.
Okay.
And when there are fractures, bone injuries, then it will fall under grade 4.
Okay.
So from this you can understand grade 3 and grade 4 automatically they will be in the emergency. So they don't require direct any physiotherapy treatment.
Or any massage or anything, they don't
No,
really.
they have to go to
Because
the
already
emergency
broken, they have to fix this first.
first, right? Maybe they will require them later on for the rehabilitation.
Yeah, rehabilitation.
After fixing the bone and the nerve. So
Yeah.
they have to go to the emergency right away. But having said that, even if it is grade 1 or 2, should we go to the emergency?
Okay.
So that depends upon how you feel. So if you feel that, sometimes even in grade 2, people get severe headaches. Concussion is another injury that happens along with whiplash. What happens when our body moves forward and backward after a rear-ending accident?
It's a total shake of body.
Yeah. So inside our skull, our brain is actually suspended, right? It's actually floating.
Okay.
So the brain goes forward and comes back. It hits on the skull, inside the skull,
Okay.
front and back. That's how it develops injury inside.
Oh.
Which will not be seen outside, but
Yes.
it is brain injury. Of course, it is transient. It can get better, but it is still an injury to the brain. That means it is going to cause what is called as concussion symptoms. So if you feel concussion symptoms, what are they? Basically, people feel dizziness, people feel severe headache, people feel very irritable, people feel phobias, several phobias.
Yeah.
They cannot function normal, they get disturbance in sleep. All these symptoms happens with concussion. So when you have all these symptoms, it's better you consult your family doctor.
Yeah.
Or go to the emergency and get some investigations done.
So after the accident, when we usually meet the doctor, right? After that, they send for X-rays and ultrasound, and then they ask for go for physiotherapy. So in that case, what the first step you usually take?
Yeah, it's usually, do we need a doctor's recommendation to start physio?
Yeah.
For that question, definitely no.
Okay.
You can go see a physiotherapist straight away.
Yeah, because there's a myth about the people
Yeah.
that if doctor will say only, then we can go to physio.
No, it's not like that. And sometimes it's also hard to get into your doctor's schedule.
Yes.
Sometimes it delays.
1 week and 10 days, sometimes it takes.
It delays.
Yeah.
Once you get the doctor's appointment, which is going to be after 2 weeks or 3 weeks sometimes, it depends upon how busy your doctor is. So once you get into them, then you see them, then they prescribe, and then you have to see which clinic is available, then you book. It's going to drag at
7 to
least
10 days, yeah.
minimum. And
By the
sometimes-
time your things are more serious,
Severe.
people have more severe pain and
Yeah.
the neck is more
the
sore.
symptoms become
Yeah.
bad.
Yeah.
So when the symptoms are bad, then what will happen? It's going to prolong your recovery period.
Correct.
So early intervention, that is as per our research, what we have found, early intervention and early therapy treatments and earlier movements help to reduce the recovery period.
Okay.
Otherwise, people suffer minimum like somewhere from 18 to 24 months
Wow.
to somewhere from up to 3 to 4 years also, depending upon, I'm sorry, the damage. So always better once you are involved. Sometimes, people feel, because after an injury, the cortisol levels are up and we feel like, oh my goodness, I have to manage, and you jump and you run, you feel like I'm okay.
Yeah.
But actually, you are not. The actual picture will come out when you go back and start working.
Correct.
That's when you feel, oh my goodness, this is something I usually used to do, but now I can't.
Correct.
Like my back doesn't allow me to sit for more than half an hour, or my neck doesn't allow to look into the screen for more than 15 minutes.
True.
And headaches.
These are the after effects, basically.
Yeah. So these ones will
Needs to be recovered quickly, basically.
as soon as possible, right?
Yeah.
So even if you have lesser symptoms, I would still say it's better to go have a physical examination done.
Okay.
So that at least you are clearing that there is no major issues going on, even if it's going to take like 3-4 therapy sessions or some exercises for you to recover. That's still good. Get that done and get better.
So how is yoga is helping in this?
Yoga, we use therapeutic yoga.
Yeah, I'm talking about that because Ayurvedic massage, you said you told about the yoga also.
Yoga. So it is not general fitness yoga, it is therapeutic yoga. Is beneficial in two ways. One is for the physical recovery. We use that mostly in conjunction with our rehab exercises. The other one is mainly the pranayama involved in yoga helps in calming down the mind and relaxing and trying to recover, mainly when you have concussion symptoms. That is our specialty in most of our branches. We try to incorporate yoga therapy into our rehabilitation exercises, which actually helps our patients to cope better with their symptoms.
Like healing your body and healing your soul, both are very important.
Very important.
And both things you are providing with your services.
It is needed, right?
Yeah.
Soul, body, and mind.
Yeah, they have to be fixed.
It's important. That's how you can expect a full recovery. Otherwise, whatever impressions you have in your mind from the accident, you are going to carry that for your lifetime. And you keep suffering from that on and off, even after recovering from your physical injuries.
As Dr. Senthil told, a very great thing that we have to heal the soul also. Body they are recovering, also they are helping to heal the soul by doing so many pranayam and the other yoga exercises, which, because when we had met with any injuries or accident, we said, oh, we are recovered and we are okay. But after effects, after 2-3 years, we are getting again those pains. Yeah. All right. Yes. So in totality, if we talk about the involvement of accident by car or by sleeping on the road or other stuff, so you gave us a detail on that. But what people can help to prevent the longer recovery, what is the best thing to be done?
Of course, first thing is earlier intervention.
Okay.
That is the first point. Any injury, whether even if the symptoms are less, I will still say go get some therapy done and start off doing some exercises.
Correct.
So that's going to reduce your recovery period, one thing. That is also going to see, I've seen many people coming. I even have one patient, particularly, she was coming for an ankle injury. And that evening she came for an appointment and she said, you know what, I'm planning, I'm going to Toronto tomorrow, so I will be seeing you after a week. But while driving here, I had a motor vehicle accident. Someone rear-ended me. So, but I'm totally fine. I said, you might be fine today, but it's always better once you come back, try to come, let's do an assessment and see how you are.
Correct.
Because after a motor vehicle accident, usually the first 3 to 5 weeks period are kind of symptoms in evolution. The first 1 week or even 2-3 days, you feel totally fine, but then the symptoms gradually starts.
Correct.
As you go back, do your regular thing, your regular work, after 2 weeks, 3 weeks, people find, oh my goodness, there is a new pain coming up.
Correct.
New symptoms surfacing. These things can come up depending upon how much physically you have to do for your work, right? So always it's better after that patient came back after a week with severe neck and back pain.
All right.
Of course she went, traveled, she had a flight travel journey, everything. So all that added up and she came back with severe pain. So I'm not telling that all the motor vehicle accidents are going to have severe impact, but it's always better to monitor how you feel the first few weeks. Take it easy, don't stress much, reduce your physical activities for the first 2-3 weeks. If needed, take some pain pills and definitely undergo a few sessions of therapy. Those are the important steps you have to take in order to prevent long-term impact of the accident.
So we have a great information today with Dr. Senthil about the accident prevention stuff, how we can prevent our injuries, how we can fix our things immediately. And Dr. Senthil will come again with us on a new topic where the other stuff is also going on, which can help through physiotherapy and their Ayurvedic therapy. So the best thing, under one roof he is having so many stuff. So if you have any question, if you have any concern, please email or text to us. Even the Dr. Senthil's number is on the screen. You can directly call upon him or meet him, make an appointment. So Dr. Senthil, the last words I want you to tell people about how they can get their things very easy with the physiotherapy and the daily lifestyle.
Yeah, one thing is to get appointments. In our clinics, our main priority is to accommodate the patient as soon as possible. We always see that we try to get same day appointments, because sometimes it's very bad condition with severe dizziness and other stuff, people will come.
Yeah.
So we always see that we try to get them same day appointments, unless most of our locations are open almost 7 days a week.
Nice.
So one of our location is open on Sundays as well. So even if it's a Sunday, we still try to accommodate them. Very rarely we give next day appointments.
Okay.
And that is more important. Once you get in, then we take care of everything, your insurance thing, if you have a lawyer to deal with, if you have an insurance adjuster to deal with, if you have to send a report to your doctor, all those stuff our support staff take care of.
Nice.
So it's kind of carefree, mind-free, like you don't have to
it's a carefree treatment we can have.
Yeah, and that is what we want to give, because already the patient is a victim of an injury and
Correct.
they are already under stress.
Yes.
We don't want to add up anything to their stress levels by, okay, sometimes it's really stressful dealing with insurance guys. It's really stressful to find a good lawyer. It's really stressful to get investigations done and figure out what's going on, So all those stuff we try to go. We have backup staff, support staff who work with every victim patient, so that they can just come undergo kind of stress-free treatment and try to focus on recovery.
Thank you so much for coming, Doctor, and we'll keep on having a health and fitness with Dr. Senthil with the different topics. So you can watch him every Sunday and every Wednesday on National Time TV, which is on IPTV 5555, or you can follow us on Facebook, Twitter, Instagram. We are everywhere and give all the information. And we are coming up the next week with a new topic. And if you have anything in your mind for the physiotherapy questions, please send us on at rajiv@nationaltimes.ca or give me a call 403-667-1351. And Dr. Senthil number is very much on the screen, so you can call him, contact him directly. If he's not catching up, then let us know so we can make an arrangement to meet with him over at the studio. Thank you so much for coming.
Thank you for inviting me.